For the past decade, Belize has been able to boast that it provides vaccination coverage for up to 95% of children. The vaccination schedule in Belize protects us from 13 diseases. This extensive coverage means that we've not seen diseases like polio or rubella in decades.
The last case of polio diagnosed in Belize in 1981. Measles was 1991. The neonatal tetanus, 1997. Congenital rubella syndrome, 1997. And rubella was in 2001. We do have some clusters of vaccine-preventable diseases like whooping cough, but the data is showing us that it's mainly among children not vaccinated.
The government covers the cost of vaccinations, and so parents can get their children immunized at public health facilities for free. But since the start of the COVID-19 pandemic, restrictions of movements has caused a delay in vaccinations.
Before, if you would walk into Matron Roberts Polyclinic, you would find 20, 30 women sitting closely to each other, awaiting their turn for vaccination of their kids. So we can't afford that now. Traditionally, the Ministry of Health, in collaboration with the communities, with parents, we get a lot done through mobile clinics. We do home visits. And some of these strategies we had to discontinue. I would say right now we have a delay about 2 months.
And this situation is not unique to Belize. That's why health experts, like the director of the Pan American Health Organization, Dr. Carisse Tain, make a call for countries to do their best to maintain vaccination coverage.
If we fall behind on routine immunizations, particularly for children, we risk outbreaks, thus overwhelming hospitals and clinics with preventable diseases, in addition to COVID-19. History has shown us that after wars or epidemics, if we allow large gaps in immunization coverage, vaccine-preventable diseases like polio and measles can re-emerge.
So what is the plan for catching up in Belize?
So we had to prioritize. From the target population, which is about 35,000 children under 5, we are prioritizing newborns, ensuring that they receive the BCG vaccine and the hepatitis B birth dose before hospital discharge. The next group is children 9 months old. We only have 3 months more to help them to catch up with all the vaccines that they would be needing. And then the other group that we're targeting is the group of 12 months and 18 months old babies. Those need to reach to all of them to provide them with the measles containing vaccine, which is the MMR. MMR1 at 12 months of age, and then MMR2 at 18 months of age. And why this group is priority at this point? Because we do have outbreaks of measles. Mexico is still having cases of measles, and we'll be knowing the European countries. And other countries in the region of the Americas also are having cases of measles. So the threat for measles is still there.
The Ministry of Health is asking parents to contact their clinic and schedule an appointment to get their little ones their life-saving vaccines.
The same space where we used to have 30, 40 women waiting for services, we may need to scale it down to maybe 5 in the morning and 5 in the afternoon. So the amount of vaccines we used to give in a day might have to spread it out in a week. So it sounds challenging, but I'm pretty sure we can get it done because we have good response from the community.
While it is a departure from the culture of clinic visits, it's just one more shift we can add to the new normal brought about by COVID-19.
We're dealing with a disease that 81% is asymptomatic. And the only way to contain the spread of the transmission is to know all who are positive and get them to do put them in quarantine or isolation. And until we reach that level of knowing all who are positive, which we don't have the resources currently to do it, it is a challenge to believe that people can just walk in like nothing happened. But it's to reduce the transmission.